Hey guys, you're watching the Best Practice Show, where we take a look at the best business practices from the best dental practices all across the country. In a great restorative practice, one of the things that you desperately need is a strong hygiene component. And today we're going to be talking about how do we get return on hygiene, ROH, and get a strong return on our investment from one of the world's top experts, one of my dear friends in dentistry, Rachel Wall. She is awesome. So don't miss this. Do me a favor, grab a pen and hit the share button. We'll see you in a second. Hey guys, welcome back to the Best Practices Show. We are having so much fun, and thank you again for watching and all the shares and all the feedback. We are loving this. So, I have got one of my favorite people in all of dentistry on here today, so you don't want to miss this. She's fantastic. And so, and we're going to be talking about how you can get a better return on your hygiene, and she's written a fabulous new book. We're going to talk about that. But before we get started, a couple show notes. We are shooting this live on Facebook. So as you're watching this, if you have questions or if you're watching it later, please add your questions to the feed, and we're going to make sure that we get you the right answers to some of your questions. And some of the questions you might be asking, other people have the same questions too. So don't be afraid to ask the questions. And we love the questions so much that every week we're giving away a free Apple iWatch and 2 tickets to Activate, which is our practice growth seminar. And just because we love great questions, and the questions get better and better and better every week. So don't miss that. Now, my friend today, who I'm just going to say this, you're just going to love her because everybody does. And now you'll have to correct this story, Rachel, but I'd heard about you, and then I was out speaking, and I was walking through the hall. I think it was in DC, right. And I go, wait, that's her. Yeah. That's her. And I went up to you and I go, "You're Rachel Wall." And you go, yes. And so I'm like, oh, I got to get to know you. And I've just heard so many great things. And you and I created a friendship there. And I've just watched you grow, and you've been such an instrumental part in working with our team and our community, and I'm just crazy grateful. And for those of you that don't know who Rachel Wall is, she has an incredible company called Inspired Hygiene, which we'll talk about in a little bit, and she is everywhere speaking, and she is a wonderful voice on this thing that's so important in restorative dentistry. But if people don't know who you are, Rachel, can you tell us your story and tell us how you did this? Because it's pretty amazing what you've done.
Well, thanks. Well, and I think exactly how this happened, Kirk, is we were in D.C. and I was walking down the hall. I was like, "There's Kirk Barrett, and I need to meet you." So the feeling is mutual, and thank you. Have a lot of respect for you and your team. I had the opportunity to be able to do some work with you guys last year, and it was phenomenal, and I will forever be grateful and really cherish that experience. It was really, really great. Oh, gosh, how did this start? Well, I'm a hygienist. In fact, yesterday, I was a clinical hygienist.
Really?
Yeah, I actually got to go back in. I like to be able to keep my hands in it, literally, and make sure I can walk my talk. And it's not easy. I have to say that. Actually, this week, I'm doing a big webinar with ADHA on hygiene time management, how to do everything that we need to do in the time that we have. And it's not easy. So, gosh, I don't even know if you've heard the whole story, but it really kind of, my consulting career kind of came out of some inspiration and some failure. I had been in a practice in Chapel Hill, North Carolina for several years, phenomenal practice, learned a ton from these doctors, and they had a great consultant in there that I was really inspired by. And, I decided, at that point, I was a little bit burned out on hygiene, to be honest. And I thought, well, what else could I do? Well, I could go be a dentist. And so I left my job. I went to work at the dental school at UNC with some amazing dentists, some of the top researchers in the perio field. I had the good fortune of working with them. And I applied to dental school 3 years in a row, and I never got in. And And I was having a conversation with a dear friend of mine who was going through something very, very challenging. And she looked at me and she said, "You're not happy. And are you sure this is really what you want to do?" And I wasn't. And she said, "Why don't you see what else is out there?" So I reached back out to that consultant, and one thing led to another. And here we are 20 years later. And Inspired Hygiene has been more than I thought that it could be. And as all businesses we have out there, we've got our ups, we've got our times that we get our team together and rally around and say, "Hey, we gotta get our head back focused on things." But for the most part, it's been fabulous, and I'm really, really blessed with the people that I get to work with on a day-to-day basis. Mm-hmm. And so our mission, all of our coaches are hygienists. So our mission is to really be able to go out and meet hygienists where they are in the practice, and then help them really get on board with the doctor's vision of what that team can be. And what it can be is more than just a hygienist running through the schedule every day and showing up and leaving. What it can be is, us as a dental team really impacting our patients' overall health and their life. And so that's what we get to do. We get to be able to go out into practices and help teams really grow from the hygiene department out. And so we have fun with it and we enjoy it.
Yeah, that's awesome. We're going to talk about this. There's so many components to this. Why is this I always love to talk about why before we get into the details of how, but why is this such an interesting conversation now in restorative dentistry with hygiene more than it ever has been from your perspective?
Well, I think that it's a huge conversation with restorative dentistry just because of the potential that the hygiene department has to make on the patients and their overall health from a restorative standpoint of helping them get the care that they need, but also from just an inflammation control standpoint, because just more and more and more, every day there's another layer of evidence about the oral systemic link, not just with periodontal disease, right? But with any kind of general inflammation, and just our expertise as the hygiene team. We got to kind of tap back into what we've always known is we've always been taught that we are healthcare providers, but we get away from that sometimes when we're trying to just run through and get through one patient and get to the next one. Right. So our patients forget to see us as healthcare providers because we forget to see ourselves that way.
Right.
So that's really our goal, is we feel like we can impact patients and the practice and ourselves if we can really step back into that and focus on that healthcare role.
Right. And I value what you just said so well. And I can imagine the ever-changing landscape in dentistry puts a lot of pressure on elements of hygiene, and people just, they respond in different ways. I don't see this a lot, but you see some hygienists are like, I only get 30 minutes to do a prophy and my doctor wants to go to 25. And I'm like, are you kidding me? And I'm not saying, I'm not here to judge, but you see all of these things going on. And I'm like, is that really the right thing
approach.
To do, right approach? And so give us some perspective in some of the trends that you've seen, and then let's take this apart, because I love this conversation.
Yeah. So, we're out, all of us, our coaching team. We've got this fabulous business team that support it. So our coaching team is out on the road speaking and coaching in offices. So we see a lot of things, and we're seeing what everybody else is with regards to, the participation with in-network. Really interesting. I think we're starting to see some practices that were really saturated with that, and now they're getting to be more selective with the plans that they do participate in. So that's kind of a nice piece of it. One of the things that we're seeing too is, patients not having the benefit for early levels of care. I think that's something that we're all kind of trying to figure out. And how do we present that to our patient and let them make the choice rather than us making the choice for them based on whatever their benefit is? That's always a constant challenge. And that takes a really strong conviction that we have this responsibility as dental providers to offer, the care that's going to get them the healthiest. And it also takes some finesse and some verbal skills and some systems, so that we're having these conversations with our patients ahead of time rather than at the back end of a procedure when all of a sudden maybe they don't get the benefit they would expect. Sometimes it's harder to have the conversations in the beginning because we're not sure if the patient's going to say yes or no. Mm-hmm. But it strengthens the relationship if we do it first rather than later.
Right. Right. And so just to get everybody's thinking right, because like I said, I love the way you think. I think one of the most important things is just the overall philosophy of what hygiene is in your practice. Would you agree? Because we can talk about how to make this. And the other thing too is I love the title you've got is Return on Hygiene, because sometimes dentists look at it as a cost. It's actually a huge investment that you're expecting a return. Can you talk about that?
Yeah. Yes. So thank you for the segue. We actually wrote a book called ROH Return on Hygiene. And what we believe is that your investment, whether you're the dentist, a practice manager, a hygienist, whatever your role is in the practice, you're making an investment of time, energy, money, equipment, all of these things that we invest in the hygiene team. Mm-hmm. We expect that you should have a very strong return on that. And not just, for the business owner, but the patients should get a very strong return on that investment. The providers in your practice should get a very strong return on that investment. And then the practice should get a return on that investment. And we believe that that's possible. And so we have this book that we're going to be offering a little bit later in the show. And then we also have a companion course that we teach at dentist study clubs. And we always encourage them to bring their staff with them because you want to be learning these concepts together. And then we look at all of these shifts that we're seeing practices make in how they're delivering care and different systems that they're putting into place to make things run more smoothly and be more productive. And we always put it through the filter of, okay, what is the return on that for the patient, for the provider, and the practice? Right. Because if one of those is left out, then it's probably not the right fit. Right. So for example, the 30-minute appointment. And again, I don't want to make a broad stroke because there are a lot of different ways that you can implement that. Mm-hmm. And, but if we're, one hygienist and it's going 30, 25 minutes and we're cranking through that might create an immediate return for the practice, but the long-term return is typically not there. Right. Because all of a sudden, all that appointment is about scaling. It's just about getting that patient in and out. And it's about that pro fee. It's not about diagnostics. It's not about relationship building. As much as we would want it to be and we try, there's only so much time in 25 minutes. So, and does that create a strong return for the patient? Typically not. And does it create a strong return for the provider? Typically not. Mm-hmm. So we've got to run it through that filter and see, are those goals, those returns being achieved? Right.
And I think this is running it through the filter. You're asking yourself really, really good questions too, and how it relates to your overall, core values. The cool part about the United States of America is you can practice however you want to practice. You don't have to subscribe to one particular philosophy. My personal opinion is you can't even have a conversation in 20, 25 minutes. I mean, you can't even ask a question really to get to know people. Now, again, that's not good, bad, or indifferent, but I think as a dentist, you can decide, hey, look, what does this mean to me? Now, you asked this, I'm going to give you full credit for this because I love this. You asked the question one time at our workshop, you said, what do you believe about periodontal disease? And we went around the room and I was like, yeah. And you see everybody gets so excited. Yeah, it's like the cornerstone. It's everything restorative dentistry. And then you go, okay, so what do you do consistently that supports what you just said? And everyone was like, we were all like, and it was so good because you asked us the question and you could see the gap from what we knew was possible and where we are. And really, I think that's what you're asking people to do is, figure out how you want to practice. And then let's start closing some of these gaps. And make sure that they all work. And so I'm taking tons of notes here. So what are some of the things that I want to pay attention to if I'm a young dentist watching this?
Well, so you brought up a good question, Kirk, is you said, what is your hygiene philosophy? And that's a question that I ask in this ROH course. Mm-hmm. All right. So tell me, just like that question about what do I know for sure about periodontal disease? What do I believe or what do I want my hygiene team to be for our patients for themselves and for our practice, right? So that kind of shapes your philosophy. What is your hygiene philosophy?
Right.
And then you run through some of these worksheets and do some of these calculations in here, and then that'll help you discover some of those gaps. So we work through that in the course. We look at, okay, where do we want to be? Mm-hmm. And then I call this the nickname for this book is also the Hygiene Benchmarks Bible. So we go through some of the key benchmarks that you want to look at with your hygiene department and really figure out where you stand and where you have room to grow. So you can look at some of your benchmarks and then you say, okay, so do our benchmarks, this is like hard data from our hygiene department. Is that consistent with what we say our philosophy is?
Right.
So from a perio perspective, if we say, yes, we believe that periodontal disease affects overall health, and it is the foundation of all of our restorative treatment, and it is the cornerstone of a successful hygiene department, all of these great things, but then yet we run our numbers and we find out that we're at 2% or even 10 or 15% perio,
right?
Then you have opportunity to grow into that vision, right? And you see, okay, so we believe this, but there's something missing. There's this book called Switch by Chip and Dan Heath. Have you ever read that book? Okay.
I have not read that one, but I've read the other one.
Made to Stick?
Yes, Made to Stick, yes. The orange one? Okay.
Yes. Okay, yeah. Great books. And so I talk about this a lot in my courses because, we go to CE or we watch something like this and we get all fired up. I mean, we all do this. And we go back to work and then you're kind of met with some barriers. Or maybe the day just gets in your way. You're met with the tyranny of the urgent, right? The things that are right in front of your face.
Right.
And you never make that change. Or, we see this in dental practices all the time where they say, okay, we're going to do this differently. And they do it for a week. And then some barrier comes up, some obstacle happens, or it doesn't go quite right for someone on the team. Then all of a sudden we just kind of throw it all out.
Right.
They say in order for things to stick, so in order for you to get your benchmarks to match your philosophy, we got to figure out, okay, do we believe this in our rational mind, right? Mm-hmm. Intellectually, is this something that we believe is as a benefit to our patients in our practice?
Right.
And then emotionally, right? We know it intellectually. Do we believe it emotionally? Is our heart into it? Because we can never recommend anything that we don't believe in our heart is in our patient's best interest.
Right.
And then you have to have a clear path. You have to have a clear path because we say this all the time, if you want to recommend more therapy or even more restorative or even increase your new patient flow, but there's no room on your schedule, then that's a huge rock in your path. We had a client recently that said they wanted to go from 12 to 24 new patients a month. And they were a bit resistant. Great team. Like they listen and they just implement things like crazy and they're super positive. And this thing was making them a little uncomfortable because we were guiding them to leaving some space in their schedule for these new patients.
Yeah.
So I said, okay, well, let's just look at your schedule next month. How many new patients do you have scheduled? Okay, we have 9. And how much room do you have left? We have room for 3 more new patients. So I didn't really have to say a whole lot more because the math didn't add up to where they were getting.
Right.
So look at those things, right, as you're trying to implement something new and close that gap is, okay, do we know this? Does this make sense intellectually, right? Do we believe it in our heart that this is in our patient's best interest or in the best interest of the practice?
Right.
And then is the way clear? Can we create some ease with which to implement this? Because otherwise, when we keep hitting up against those barriers, we just usually turn around and go back the way we came from.
Right. And I love to, because I hear so much chatter on this, and I would love to know your opinion on this, and I know you can get more perspective if you just get the book, but let's just talk about perio numbers, because I believe, as you do, perio is the foundation for a lot of great restorative dentistry.
Yeah.
But I do see this, a lot of practices have 10%, 4%, 5% of the 4,000 codes. And some dentists will go, well, that's just, I don't want to get all aggressive and charge patients all this money.
Yep.
Or you see it on the other side where hygienists just don't value what they do, and so they underpresent it, undervalue it, and now you've heard the cliche, we serve champagne but we charge for water, type of a thing. So so give us, and I've heard, is it supposed to be 30%? Sometimes people say 35%.
Yeah.
So if I'm a young dentist watching this, what are some of those like a benchmark like that, and what would I do?
Yeah, so 30 to 35% is what we, consider healthy. And certainly we have some clients that are higher than that. And certainly we have some clients that started at 2% and they got to 8%. And man, we celebrate that, right?
Right.
Because you don't go from 2% to 30% in 6 months, right? This is a process. Now, we've got one client right now that went from 2% to 21% in about 6 months. And that's huge. They went from 12 quads a month to 99 quads a month. And they're a pretty conservative bunch, to be honest. But what was happening is it was actually that. They were serving champagne and they were telling their patients they were giving them water, and their patients really didn't even know that they were getting champagne. I mean, I'm trying to, stretch out this analogy a bit, but what we find is they typically know what to do. We need to develop that belief and show them the impact that it has on the patient more than their teeth.
Right.
And then create a path that makes it easy, right? Give them some verbal skills, tell them how to handle, the patients they've been seeing for a long time, that now they're going to recommend therapy. How do we do that and build the relationship? Because that's the thing, is people are most afraid of damaging relationships. But what we've found is that you can certainly make this shift and do this and actually deepen your relationships with your patients.
Right.
Because you're making this about them. It's not about me and what Rachel Wall came in and taught us to do, or my new protocol. It's about the patient. How can I best serve the patient? Right. So going back to the percentage. So, and what you said as far as, we don't want to be crazy, overcharge patients. And we don't want you to do that either. And we really are able to kind of meet practices where they are and say, okay, here's where you are. And we ask some key questions, just like you said earlier, that help them discover for themselves where they want to go with their perio program. And then we help create that path for them. Yeah. So instead of us coming and trying to like put a square peg in a round hole, it's okay, let's ask you some questions and help them discover, so this really is in our patient's best interest and in our best interest to identify this disease and then give them a solution. Right. And, sometimes they'll say, well, our patients are really healthy. I mean, usually that's not the case. Usually they know, the dentists usually know that if we've got 4 hygienists and they're doing, seeing one patient a month that we're delivering periotherapy to, they know there's a gap there.
Right.
But they're afraid of that damaging the relationship, I think, and scaring patients away or doing something that's too aggressive. And so you can make a huge impact with a very approachable, practical, proactive, but not over the top philosophy around periodontal disease. You really can. And then there are different layers, right? There are different layers of it. So some teams are already doing really well. You don't have to be at 2% perio to grow to the next point, right? Some teams are doing well, but they're like, we know we could do more. And so here's an interesting thing that we see, because you probably have some folks out there in this situation is, maybe they were at that low percentage of perio and they worked on that. And they really got it up and they got a lot of their patients into therapy. And we say, maybe they were stuck in what we call the prophy trap. Then sometimes they go and they get stuck in the perio maintenance trap. So now all these patients go into perio maintenance and then they're not sure when to put them back into therapy. So we help them with that too. Okay. So when you're looking at when you're going through this, and I mentioned this in the book, but when you're going through this and we give you a tool in here to very easily determine your perio percentage, look at the ratio between the amount of active therapy, the SRP numbers, and the perio maintenance. Because sometimes you'll have a lot of patients going through active therapy, but nobody's going into maintenance. Right. And you'll have a pretty high number. And sometimes you'll have a lot of patients going in that are staying in maintenance, but not very many going into active therapy. And perio maintenance can be carrying your number. So there's even like a deeper level of analysis that can happen with that number.
Right. Now, when you talk about numbers too, I'm going to ask you the tough questions that I get. Do you have your hygienist report this on a regular basis? And it's really not about the numbers. I got to say this. It's not about money. I have found that any data, first of all, it's there's no emotion when you're talking about data. The second thing is that when we share the same coach, Dan Sullivan, and he said this, what gets measured gets improved, but what gets measured and reported on gets exponentially improved. Yeah. What's your philosophy on having a hygienist report their numbers or share numbers or talk about numbers?
Yeah, absolutely. I think it creates automatic accountability. In fact, we were talking with a team who had implemented a really simple huddle system. Mm-hmm. And this was the team that went from 2% to 21%. So there's proof in the pudding here. Right. And one of the things that they said is in the morning huddle, their hygienists were looking ahead, obviously prepping for the day and seeing, okay, so Kirk's coming in today and I've been planting the seed with Kirk. We've been talking about his bleeding gums for a while now. And so I'm probably going to be presenting therapy to him today. And if anybody's available to help come in perio chart or doctor, just keep an eye out because I'm going to be calling for the exam early and would love for you to come on in. And maybe there are 3 or 4 or 5 patients on the schedule that day. And then the next day at the huddle, right, they're saying, okay, guess what? I saw Kirk. He was super receptive and he's on board and we're going to help get him healthy. Right. So all of a sudden, if you ask the question, okay, what happened yesterday? What were the successes we had yesterday? Then it almost creates that automatic accountability. But yes, and like you guys, we're actually going with our clients to a more, how do I say this? I want to say hands-off approach for collecting the data so that we can spend more time analyzing and looking at the data. Right. So we're starting to use, a system to pull that data for our clients instead of them entering everything by hand, but then having some time specifically where we show them, okay, how can you look at this information in a way that's not overwhelming? Because sometimes you can just get too much and just zero in on what are the things that we want to measure. That's the other piece about the change that they say is we got to be super clear on what is the expectation. So if we just say we want to do more perio, but we don't define that, that's kind of goal setting 101, right? We've got to make sure we have a very measurable goal. And if we say we want to go from 12 quads a month to 20 quads a month, all right, how are we doing with that? So absolutely, I think that's very important because otherwise we just don't really know what's working or what's not. We think we know. We're like, I think it's going okay, but let's look at it because a lot of times you have a huge reason to celebrate and you wouldn't know if you didn't look at the numbers.
Yeah. And there's things that we learn, and tell me, Rachel, if you've seen this, it's the overall benefit. When you describe it benefits everybody, the patient, the practice, the provider, all this kind of stuff, because sometimes you might think, well, that's just the profitability in hygiene. I have found that the more perio that's done in hygiene, the more restorative work gets done later on. Is that a correlation you see also?
Yes. Okay. Yes. And one of the things too that some of the doctors might be thinking is, when you go through this time where you're heavily promoting perio because maybe you haven't in the past, a lot of times the doctors worry about how that's going to affect restorative. Right. And so I think that it's worth a conversation, and one that we have with our clients is let's just pull that elephant out of the closet and figure out how to address that and have the doctor say, okay, so what are some times when restorative would come before perio, right? If there are needs there, what are some times that restorative would come before perio? But doctor, what is your overall philosophy of this as far as it being the foundation? And and perhaps it is just that comfort level of talking about and presenting treatment and seeing a good result. So every time that we can illustrate to our patients and show them, hey, look at your before and after, whether it's a perio chart, whether it's a photo, right? A photo with an intraoral camera of here's inflammation before, here's no inflammation after. Like we're just cementing for our patients that they made a good decision to move forward with treatment with us. And I think that probably has a domino effect on other treatment. And by the way, we hear from our clients over and over that it's easier for the doctors when they're doing restorative and the patients are not inflamed. So they notice all of a sudden, they're like, hey, all these patients that I'm working on every day, their gums aren't bleeding like crazy because they're now going through treatment and they're getting better. So it's helping the doctors be more efficient and do better dentistry.
Yeah. And you could speak to this too. I feel like there's just not a ton of calibration that happens restoratively and I'm other than you guys and other than coming to some of the courses that, we might do, there's not a lot of courses that you go to where hygiene gets a lot of attention, and then also and how it all works together. Would you agree? And what are some of the things that you might be able to help a young dentist watching? Because that's huge. You do have to calibrate that quite a bit and quite often, regularly, right?
Yes. And I mean, calibrate is just such a wide term. I mean, that applies to our verbal skills, what we're saying,
right?
With the business team and the clinical team, are we speaking the same language so the patient gets the same message? Yeah. From a clinical standpoint, absolutely calibration. And the whole team needs to understand that. And so that can be anything from as super clinical to, are we angling the probe the same? Are we reading the probe the same? Are we getting the same numbers? I mean, that's an exercise that we do to, okay, we agree that this is periodontal disease, and at what point are we going to recommend treatment? Yeah. And then all the way to, let's get calibrated with doctor's treatment philosophy so that the whole team can really promote that. And it doesn't mean that we're never going to have times when me as a hygienist, I'm going to recommend something and the doctor says, you know what, actually, I think we could do this or this instead. And I'm not going to take that personal. Yeah. But that creates an opportunity for calibration. So that is a overarching theme that I think, like you said, is probably underrated.
Yeah.
Yes.
Absolutely.
Yeah.
Absolutely. And let's say I'm just getting started in practice here. What's one of the biggest pitfalls that I have to be aware of, or the biggest missed opportunities from what you see on the hygiene side?
Biggest missed opportunities, biggest pitfalls. I think the biggest pitfalls, and this is challenging with, when we see reduced reimbursements and heavy, participation in PPOs, and really, having to look at the time and the profitability of that. I mean, that's a real thing. I'd say one of the pitfalls is dramatically reducing the time of the hygiene visit, like we talked about. We have some clients that are working at 50 minutes and they're doing a fabulous job. So if you can get super calibrated and super efficient and use all the tools at your disposal to their fullest, like your intraoral cameras and your ultrasonics and all of those things that help us do a really great job efficiently, then it can be accomplished. But I would say that's one of the pitfalls, is just kind of the knee jerk of, okay, we need to see more patients in the day because we're being reimbursed less at a lower rate. I'd say one of the other pitfalls is just kind of allowing yourself and allowing your team to kind of fall into, this place of complacency or fall into a rut. Because none of us really want to be in a rut. Right. But, dentistry is hard work. I mean, that's another reason why I go and do days of hygiene. I mean, yesterday, it was hard work. Yeah. So, you get tired, and sometimes you just want to know what to count on. So you don't want to change things every week, right? But you want to always let your team know, say, hey guys, you guys are doing fantastic, and we're always going to be upping our game. We might not, we're going to keep things in place for a while, but when we master that, then we're going to the next thing. Right. So just kind of set that, I think, expectation of constant and never-ending improvement in a way that is empowering, and rather than in a way that it's never good enough.
Deflating, yeah.
And you might be able to speak to that really well, because I think there's a fine line there. I don't know. What are your thoughts on that, Kirk? Now I'm going to interview you.
Oh, well, I go on for an hour on that one, because I'll get this. There's a danger getting good at anything or exposing yourself to a lot of information. You fall into what we know as the gap, which is the ideal. And then you go, well, I'm not I don't have that, or we don't, and you can live in the gap, whether it be your marriage or your practice or your team or your patients. And I think as long as you're making small little progress, because my team will say this to me, are you ever happy? I go, I'm so happy, but I'll never be satisfied. Like I think it's part of the DNA. If you're a business owner in the United States, part of what drives you, or probably why you went to dental school, is you have that drive, and it's okay to recognize that, but also recognize that it can be very wearing on your team.
Yeah.
If you don't stop to celebrate every once in a while and go, look how far we've come. And I love the analogy of climbing a mountain. I think every once in a while when you're climbing your mountain, it's okay to just get to a clearing, grab a sandwich, and go, guys, look how far we've come.
Yeah.
It's awesome. Like I really appreciate this. And now, and let them know, it's a mountain without a top. You don't ever get there. And part of it's cliche, but the journey and all that kind of stuff. But I think it's important. It's important to recognize both sides, because it's very easy as a business owner who's got a high drive to get mad at your team. And, you can't do this without their help. They have to be all in. And we're getting a couple of comments now. These are great. On the first pitfall, I want to go back to the first pitfall that you mentioned, which is the reimbursement. So Dr. Tang asked this question. We're heavy on insurance participation PPOs. Have you run into problems with insurance companies not paying? And how do you address this with the patient?
Okay, so good question. Yes, I think we all have run into that. And what we're finding is that the threshold for reimbursement is being raised by the insurance companies to a frustrating level. And I'm not an insurance expert. We work a lot with people like Charles Blair and Practice Booster, Roy Shelburne, Teresa Duncan. These are the people that we kind of go to for advice on this and to guide us on this. But we get these things from our clients, and we get claims that we see that is obviously periodontal disease, and the insurance company is not providing benefit. In fact, I even saw one where they were disallowing the procedure, which really puts a doctor between a rock and a hard place. So I'm going to suggest, if you haven't already, and I have to look back in your archives, Kirk, that you have someone specifically address this. But the question was, are we seeing that? Yes, I think we're seeing that across the board. And so here's what we recommend. And here's the recommendation that I've gotten from the experts and I saw this in practice yesterday in Dr. Chris Bowman's office, who I've worked with for 10 years, and they do a really great job with this, is I'm gonna name drop just because I love it. I love to quote people. And so another great dentist that I've learned a lot from is Dr. Bruce Baird. And he says, handle the objection before it becomes an objection.
Right.
So if you see that there may not be benefit, then we need to let the patient know that ahead of time. And that can be scary, because sometimes we think, well, if I tell them that, then they're not going to want to do the treatment. Well, it's better for them to have the opportunity to say yes or no, and have us say, here's scenario A, not necessarily best case or worst case scenario, just here's neutral scenario A, is that, your insurance company would rather your periodontal disease progress to a much more, serious level where you've lost a lot more bone and it's affecting your body, at a higher level. And so in that case, you may not receive benefit, and here's what the fee would be, and here's how we're willing to help you work that out. So giving them some options. Scenario B is they do provide benefit. Right. And then you're going to have this much contribution, and then here's your part and how they're going to work that out. Right. And what I'm being told is that as long as we're doing that up front, even with those patients that are in network with these plans, is that then they can choose to pay for the procedures, and there's a document that they can sign that allows them to accept that financial responsibility, even though it may be outside of their plan. But we've got to let the patients know that ahead of time, so that they know what they're getting into, because the conversations that we have after they've had the treatment and then they didn't get reimbursement can be really bad and can really damage relationships, and patients can leave over that. It's not easy to recover.
Yeah, and it's so brilliant what you just said, because that's really the problem, is letting patients know in advance. And I don't know if you said this, or Leanne or Chris, or I just pop in on those sessions, and you guys are I heard one of you say this: diagnosis is a neutral condition of findings, and really just because sometimes we're so afraid of overwhelming a patient that we really do underwhelm them consistently. And so letting them know that here's what we see, it's not good, bad, or indifferent. And here's what might happen is a big piece of this. So great stuff. Great stuff.
Yeah. And then taking them all the way down the path though. So we can't just take them to the diagnosis and then just be like, later, do you want to schedule later? And, so taking it all the way through and here are the options. Here are your options, assuming that, right? Rather than asking, do you need financial options? Right? Because then all of a sudden you put them in an awkward position. Is here's what we offer. Here are the options to help make this work for you. What looks like the best fit.
Yeah.
So now they can say yes to something rather than just yes or no. Yeah.
Yeah.
So I think those conversations ahead of time, and it's not any less delicate, right? But I think it's just the right thing to do for our patients when we're in that position, is letting them know in advance.
You are so spot on. And Dr. Tay, that's such a great question, because I don't think it's going to get any easier in the future with the landscape, with what's happening and the changes. So,
yes. And I'll mention one other thing too, that will help, with this is, and I saw this recently in a practice too. And I will say, I've learned this from Lois Band to Roy Shelburne, all the greats, is document the heck out of your diagnosis.
Yes.
And one of the things we're teaching heavily that I don't think any of us have done enough of in the past is, we love taking pictures of those nasty old amalgams and big old cavities and things like that. But what about the bleeding gums, right? We've got to make sure that we're taking pictures of perio. And someone shared with me recently that they were, they're doing some grafting, but they didn't have a picture of the before to show the reason for the graft. And I'm like, arr. So, make sure you're just taking pictures of everything to document your diagnosis and provide that reason for treatment. And I think the photos are just becoming more and more and more important. And just, make sure you send clinical notes, send patients' conditions, health conditions. All of those things are going to be, it's just layering your diagnosis, and it's layering your case that you're making, that this is in the patient's best interest.
Yeah. Now, I'm going to keep asking the questions that I get, and I'm just going to throw them to the experts. So I got a young dentist who's taken a lot of education. Now, he purchased a practice with some hygienists that have already been there. Now, he takes all this education, comes back, and if he's watching this, and I'm going to encourage him, he's going to go, Rachel, absolutely, like we have to, but they won't do it. So what do you say to that? Because I'm sure there's a few people watching this going, hey, look, I totally agree, but I've got some hygienists that have been here for a long time. How do I get them to do this? So what would you say?
Well, I think so back to switch. Is they say when sometimes resistance, what appears as resistance is a lack of clarity. So I think the first step is we've got to be super clear with what the expectations are. And so my advice would be is to sit down and get really clear on what is our philosophy as a practice. Right. And ask the hygienist, what is your philosophy? So if they say, we want to be a center for health for our patients, we want to do what's in our patient's best interest, we want to, be their dental home and all of those different things, then I think you can go back to that and say, okay, and so what does that look like? What does that mean from a treatment perspective? And then see, okay, now are we doing that?
Right.
How could we serve our patients at a higher level from the overall health perspective? So it's always good to come at it from their position. And what we find is a lot of times the hygienists are just as frustrated with the way things are as the dentist is, but they don't know how to change it, or they don't know that it can change, or their dentist would allow it to change. So if sometimes we ask, what's working really well in hygiene to the hygienist, what's working not so well? And then we kind of look at what's working not so well according to them and figure out how can we come from the approach of solving that problem? So what's not working so well is that I can't get everything done in an hour, and I'm running over, or I never hit my goal, or what's not working so well is all this open time. Now all of a sudden we've got like 4 different angles that we could say, okay, so here's one way that we could approach this. Is, this Rachel Wall person has this idea that if we actually spend more time on the diagnosis and less time on the scaling, then it's going to help our time management. Would you be open to learning about that? Right. And would you be open to learning and growing? Would you be willing to try something that might be a little out of your comfort zone if we could really look at solving some of these frustrations that you have and see what they say? And there does come a time we are not we are very reluctant to advise a dentist to release a hygienist. But occasionally, I would say once every couple of years, it seems pretty obvious that that's what needs to happen. And if a dentist has a really, really strong philosophy and they've tried to come about it in all these different ways, I need your help. Here's what I'd love to see with our patients. How can we make this happen? And come about it in a really empowering, encouraging approach, and still being met with resistance. I think it's time to have a conversation of here's my vision for the practice. Here's what I feel like our patients deserve. And it seems like that might not be a fit for you. Where is this not lining up for us? Right. And are we a fit to work together? And, it's a tough conversation to have. Most of the time, we find that it is that clarity and expectation, and then making the hygienist, letting them know that they're being heard. What are you worried about with going to this, learning, going to the next level? What are you concerned about? What are you worried about? How can I allay your fears? Is that I think 90% of the time, that takes care of it. Just allowing them to know that they're heard and making the expectation clear. If we can give you some tools to get to this way, and we're all going to support each other, are you ready to be on board? And then the other 10% of the time is, when you really have to have a heart to heart.
Yeah, I totally agree with you. Giving them the opportunity to succeed and giving them the rules to succeed. I think that's one of the tools. Yeah, and then if you've given them the rules and the tools and have heard them and they still resist, then you have the opportunity as a business owner to make a choice. And there are sometimes it's good to free up their future and and bring some new energy. And sports teams do it all the time, So it's just part of business, and it's unfortunate. But I agree with you. Give them the opportunity to win first, So absolutely. And so many great comments. Rita said Rachel's a super bright, smart overall. Also, I totally agree. Now another question. Deepak asked this one: should dental hygiene schools take some responsibility in graduating hygienists that understand how hygiene is a business within a dental business? Great question.
Yes, I agree. Actually, my good friend Pam Kike, Pam Kike, who is a hygiene instructor in West Virginia, ordered a bunch of our books, and for that very reason. And I love that, right? Because she's going to go through that, I hope, with her hygiene students and share with them, here are some of the benchmarks. Here's some of the expectations. I mean, that's something that I share a lot when I teach my Business of Hygiene course, is I show a picture of my hygiene team when we graduated, and there may have been a handful of us in there that were dental assistants that might have known a little bit about, how hygiene contributes to the business, but I had no clue.
Right.
And I think it's improved a bit, but probably not a lot. So yes, I think that that's great, and I fully support that.
Yeah, absolutely. So it's good question. And Janice Hurley said, feeling heard. So I love her. So any other considerations, things to consider if I'm a dentist or a hygienist watching this and I want more ROH? What are some other things that we consider?
More ROH, more return. So this concept, I think for our patients, some things to consider is just looking outside the box, looking at what are some things that we might need to add to our diagnostic toolbox and our treatment toolbox for our patients from a hygiene perspective? You know, whether it's a preventative, whether it is therapeutic, diagnostic, you know, yesterday. So this is another reason why I love having these clinical hygiene days, is because I'm like, oh my gosh, I just came away with this day with so much material. You know, I had a diabetic patient who has recurring periodontal disease. So we decided to look at his bacterial profile, look at his genetic profile. So he wanted that information. And so let's just offer it to him to see, where are we? Might there be some additional therapies that could help kind of reset, you know, his immune system to help him really fight these periopathogens? Yeah. And his A1C was higher than he was hoping it would be. And he didn't have dramatic out of control disease, but it was, you never know, like these low levels of chronic inflammation can really affect people, particularly those that have these other risk factors. So I would say, as far as a return for patients, really opening our minds to some of these adjunctive tools. And then we, you know, that's one of the things we do is help teams implement that. Return for providers, I think it's just really maybe having some conversations with your hygiene team and seeing, you know, what is working really well? What can we celebrate? I mean, dentists, the thing that team members want the most is acknowledgement. Right? They want to be acknowledged for the heart and soul and blood, sweat, and tears and everything that they put into that practice every day. And, you know, sometimes just at the end of the day saying, you know, thank you so much for what you did and what you do for my patients. It really means a lot to me. That goes a long way. Mm-hmm. So for your providers, just, you know, having an opportunity for them to share what they think could be improved in the practice, you know, and then empowering them to do that. And I think for the practice as a whole is grab our book. Yeah. But, you know, grab our book so that you can kind of see where you are, where your hygiene department stands. There's a few key benchmarks in here. And then we give you some tips on how to move the dial on that, right? How to get that to the next level, whether it's a profitability thing, a time management thing, you know, whatever it is that you are ready to grow in that area.
Yeah, absolutely. And if you're watching this, don't even hesitate. Go to there's a link right to the right. Just click on it. If you're listening to this on iTunes, it's rohbook.com. Just go right there. And you've offered to give everybody the book for free. Thank you very much.
You're welcome.
I get the first copy. So, and all you just ask is for shipping, which is $7.95, right? So you get it for free. Nothing is easier than free. And she's got some incredible, I've seen some of your diagnostic tools, but I can imagine this one is some of your best work. And just if you want to diagnose yourself and where you can get a little bit more return on hygiene, it's a great place to start. And I would say even get a book, get one of them. You can afford $7.95 per hygienist. Get a copy for each one of your hygienists. Heck, you've got 2,100 hygienists on this webinar. I mean, so they're starving for this information. Don't think you're the only one that wants this information. They want it too.
Yeah, and you must enter the promo code KIRK, KIRK, to get your $7.95. So don't forget that. That's probably in the link that's here. On the page. And there's some great worksheets in here. You can get the full page worksheets and do this as a team together. Great kind of interactive book there for you. And thank you so much, Kirk. It's always a blast being with you. And thanks everybody that's been watching. Really appreciate taking the time to do that today. It's been fun.
Yeah, absolutely. So stay on, Rachel, for a second. We're just going to say goodbye, everybody. But thank you guys again for watching. Just like Rachel said, I'm just so crazy grateful and love the questions and the feedback. Please keep giving it to us. And again, if you're watching this later on, please add questions to the feed. Rachel will get back to you. We want to make sure that this is hugely valuable. And so if you found this valuable today, do me a favor, hit the share button, share it with your friends. And until we see you next time, keep watching the Best Practice Show. You guys have a great day.